Welcome back. Ben Nangombe, the Executive Director of the Ministry of Health and Social Services in Namibia, has been at the forefront of various healthcare initiatives in the country. One such project is the Voluntary Medical Male Circumcision, the VMMC program, which aims to reduce the risk of HIV transmission. In this interview, we delve into the details of this project and its impact on Namibia's healthcare landscape. Mr. Nangombe, good evening. Thank you so much for joining us.
Good evening, Nina. How are you today?
I'm good, sir. How are you this evening?
I'm doing very well. We are attending the Namibia-Ghana Joint Permanent Commission of Cooperation Senior Official Meeting in Swakopmund, and that's where I'm talking to you from.
Fantastic. Well, Mr. Nangombe, we're talking about the VMMC project tonight. Perhaps you can provide an overview of this project and the objectives that the ministry has with this initiative.
Yeah, basically the national HIV/AIDS response, that is the strategy of the Namibian government to reduce the spread of HIV/AIDS in the country, specifically the strategy to reduce new infections, is achieved through a number of interventions. So, for example, we look at protecting or reducing the HIV, the vertical transmission of HIV from pregnant mothers to their babies. We look at the reduction of HIV/AIDS spreading to adolescent girls and young women. We also look at prevention of the spread of HIV through the barrier method, for example, that is using condoms, and also through voluntary medical male circumcision, because it has been found that where men have been circumcised, the risk of the transmission of HIV is significantly reduced. So the VMMC, or Voluntary Medical Male Circumcision, is part of what is known as a combination prevention strategy to reduce new HIV infections or incidences.
And how has the ministry been promoting and implementing the VMMC project across the different regions of Namibia?
This has been done in a number of ways. The ministry carries out campaigns where we take these services to the grassroots, where we join different partners that support the implementation of these initiatives. We have, for example, in the past involved or engaged the ambassadors, young people, artists, for example, community drama groups, and basically also healthcare workers going out in the communities, sensitizing the communities, and this includes the community healthcare workers who are deployed across the country with the aim of addressing this, the spread of HIV and also other illnesses. So, for example, in a number of instances, King TD, for example, has been an ambassador for VMMC. Other artists have been also ambassadors for VMMC, and these are the approaches that we are using to reach the target population. We have also engaged community leaders in many areas of the country to encourage young people or men to undergo these procedures, as well as, for example, where the circumcision of baby boys who are born being circumcised in the hospital setting.
Has the ministry encountered any challenges, in terms of community engagement or acceptance of the VMMC program?
Yeah, I think, again, circumcision in the Namibian context is in a number of instances seen as cultural practices. There are those communities where circumcision is an uptake, gets more uptake because it's a cultural practice and sort of compulsory among certain population groups. May not be the case in all demographics. So where this is taken up as initiation, for example, in communities, there the acceptance is higher and is perhaps less so in other communities where that is not necessarily a practiced cultural practice in a particular demographic of our country.
Just lastly, Mr. Nangombe, what are the future plans and goals for the VMMC project, and how will the ministry measure its long-term impact on HIV prevalence and public health in Namibia?
Yeah, Namibia has done very well as a country towards the elimination of the spread of HIV/AIDS and actually combating the HIV epidemic in the country. On the 95-95-95 cascade of UNAIDS, the fast-track targets, and that is to say, what we aim at, or what these goals aim at, is to say 95% of the people who are HIV positive must have been tested and must know their status. 95% of the people who know their status must have been initiated on ARV and should consistently be taking their medication in order to achieve viral suppression. And then 95% of the people who are on ARV and initiated on treatment must be virally suppressed, meaning that if a person has taken their ARVs, their antiretroviral treatment drugs, consistently, the virus in their body is going to be suppressed to the level that it becomes undetectable. And we say that if it is undetectable, when you are tested, it's untransmissible. So not only does the person who has a low viral load start to live a healthy, productive life, but if should they engage in unprotected sexual activity, then they are not able to, or they cannot transmit the virus to their sexual partners. So with respect to VMMC, as I indicated, this is part of the combination prevention strategy. It is an intervention that is going to continue. We are going to pursue this strategy. We are continually monitoring and evaluating the effectiveness and efficiency of these interventions. And because we now know that, for example, some of the populations that are left behind, when we talk about HIV prevention and the spread of new infections, are young men. And we are going to continue to engage with communities. We are going to engage with young men to encourage them to live lives where the sexual practices are safe. And we are going to continue to engage with them to also encourage them to undergo VMMC, because it is one of the methods that would serve to reduce new infections and transmission of HIV in the country.
Mr. Nangombe, thank you so much for your time this evening, and thank you for joining us here on the Daily Roundup.
Thank you very much, Nina. I appreciate it.
That was the ED of the Ministry of Health, Mr. Ben Nangombe, speaking to us about the ministry's Voluntary Male Medical Circumcision project, an ongoing project. We'll be right back after this brief break. Stay with us.